This is the Psychedelic Medicine podcast.
Hello and welcome to the next episode of the Psychedelic Medicine podcast. I'm Dr. Lynn Marie Morsky, your guide on this journey, and today we're going to be discussing MDMA-Assisted Couples Therapy with Dr. Kayla Knopp. Dr. Kayla Knopp is a clinical psychologist and researcher specializing in non-traditional couples and relationships. She specializes in making couple therapies more inclusive, accessible, and effective, including MDMA and ketamine-assisted couples therapy. Now, before we get to Dr. Knopp, just a reminder that the Psychedelic Medicine podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And a reminder, as always, if you are a clinician and you'd like to learn more about the clinical uses of psychedelics so you feel comfortable discussing them with your patients, please visit the Psychedelic Medicine Association. It is our mission to educate clinicians from doctors, nurses, therapists across the spectrum on psychedelics so that when there is a psychedelic option that is right for your patient, you feel comfortable discussing it and perhaps referring that patient to psychedelics if applicable. So we'd love to have you join us. Please visit us at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Kayla.
Thank you so much for having me. I am so excited to be here talking about this topic, which is one that I just love. And I just love this podcast and the mission of the Psychedelic Medicine Association. So I'm really pleased to be here.
Oh, thank you so much. You are making my heart expand. So thank you so much. Also, Kayla is a fellow San Diegan, so shout out to all my West Coast friends. Woo! Yeah. So glad to have you on here and to discuss something we have not done. I don't know if we've done any. We have definitely not done a lot of couples therapy episodes, and so I'm very excited to have this conversation. Now, as I remember, after a lot of the other psychedelics were made Schedule 1, MDMA was made Schedule 1 much later, and so I believe there was a period where it was used in couples therapy back in the day. Can you talk a little bit about what that looked like?
Yeah. After MDMA was synthesized in the late 60s and then resynthesized in the 70s, it was used kind of in outside of research contexts, right, in sort of clinical practice, I think both in formal and informal ways. But a lot of folks at the time were really, it was kind of the zeitgeist at the time to be focusing on relationships and love and sex and how to get more freedom in all of those areas. And so I think that was a lot of some of the goals of the way that people were using MDMA with couples at the time. So there wasn't really a standard protocol that folks used. It was pretty much mostly not, done in a research context. So we don't have a lot of data, about the outcomes or anything like that. But a lot of researchers and clinicians at the time certainly made good use of MDMA. I will say even after MDMA was made illegal, it certainly still had a really big presence in the underground kind of psychedelics world, which is not something that I personally participate in as a licensed clinical psychologist, but I'm aware of what folks are using. And MDMA is such a natural fit for couples work that I think people just really, really like it for that use.
Yeah, and I'd love for you to tell us. So we've done an episode before with Rick Doblin on MDMA for PTSD, and so I'm I don't remember the entire thing, but I'm sure he talked about how MDMA tends to take the amygdala offline, kind of the things that they say takes your fear center offline. Yeah. But I think that there are probably maybe that and other reasons why it's effective for couples therapy. So can you talk a little bit about why MDMA tends to lend itself well to this?
Yes. So it's interesting. So I can talk a little bit about why MDMA is a great facilitator of couples work and also why it's a great facilitator of couples work in the context of partners, one or more partners with PTSD, which is one of the main research areas that's going on right now too. So I think there's a lot of overlap there as well. And the reasons that MDMA can be helpful for couples work are so numerous that honestly, I don't think that I can recount them all by memory. But it does so many things that are facilitative of the primary goals of couple therapy, which are to reduce defensiveness, to increase the flexibility that we have in taking our partner's perspective, increase the empathy and intimacy that we feel with other people, increase the reward that we get from positive interpersonal interactions. MDMA tends to upregulate serotonin and dopamine, as well as oxytocin and vasopressin. So you've got this good neurochemical cocktail that helps people feel, it really mirrors a lot of the kind of neurochemistry of being in love and experiencing love. And yes, as you said, it downregulates the amygdala and upregulates the prefrontal cortex. And so a lot of these kind of biological effects can really enhance, the ability of people to be present with emotion, to really hear and understand their partner, to want to, be closer to their partner and to want to understand them more, and to experience less threat from things like relationship disagreements and conflicts.
That makes a lot of sense. And I was, because I know you said, okay, you're going to talk about why it's effective as a couples therapeutic, and then also why it's effective if one person in the dyad has PTSD. It occurred to me while you were talking, what does it look like? And we'll get next to the if one person has PTSD, but maybe in whatever order you feel would be best to answer this. But it occurred to me that, like, what if one person in the dyad has caused the PTSD of the other? Is that best still addressed as a couple or one-on-one? I'd just love to hear your thought on that.
Yeah, so you're talking about in a case where there's like intimate partner violence perpetration, something like that?
Yeah, or even emotional abuse or some kind of, any kind of interrelationship trauma, intra-relationship trauma.
Right. Okay. So I'll distinguish between, there's sort of the abuse category of relationship trauma between partners. And that is something where we actually would not recommend doing any kind of couples intervention, including, any kind of psychedelic assisted couples intervention. Typically, when there's any kind of intimate partner violence or serious aggression, that's best treated in an individual context that helps both people get safe, and that helps perpetrators of violence manage their behavior and their emotions in better ways. There's another category of relational trauma that is like sort of relationship betrayals and infidelities. We often conceptualize these things as kind of relational traumas. They're sort of trauma or injury to the attachment bond that occurs between two partners. So that category of relational injury and trauma can be very well addressed in couple therapy. And really, I think we don't have any data to support this, but I am so eager to continue to do work with psychedelic assisted couple therapies to address infidelity and other kinds of betrayal traumas in relationships.
Okay, that's a good distinction to note. And what were you going to say about the couples therapy when one person has had PTSD themselves?
Yeah. So broadly speaking, mental health and relationship functioning are like reciprocally related, right? They're very closely intertwined. My mental health impacts my relationships impact my mental health. So as a clinical psychologist, I care a lot about both of those things. When we treat relationship dysfunction, we know that mental health often improves as a result of that. And conversely, we also know that sometimes when we do mental health treatments, if we ignore the relational context that somebody is living in, we only give them part of what they need in order to fully heal, kind of psychiatrically. So couple-based interventions for mental health disorders, including PTSD, are kind of up and coming as a really effective way to address mental health concerns. And one of the sort of most well-established and well-researched couple-based interventions is for PTSD. The model that I'm most familiar with is called Cognitive Behavioral Conjoint Therapy for PTSD. It is a mouthful. CBCT for PTSD was developed by Candice Monson and Stephanie Fredman. And it's between 8 and 15 sessions, depending on the version that you do, and really helps couples understand what PTSD symptoms look like, and in particular, how they show up in a relationship and how they interfere with relationship functioning. It helps couples learn some basic behavioral skills so that they can interact better despite the PTSD symptoms kind of being present. So, for example, PTSD can often kind of elevate feelings of general irritability, right, as part of like hypervigilance. So, we teach couples conflict management and communication skills so that the kind of irritability and hypervigilance isn't so damaging to relationship functioning. And then this treatment also helps couples address some of the underlying kind of causes and maintaining factors of PTSD. I don't want to get too far down the rabbit hole, but there are some good cognitive theories of PTSD that suggest that avoidance is one of the major processes that maintain PTSD symptoms for folks. And so when we can help patients avoid PTSD related triggers and cues less, they actually start to heal more, right? And so, especially doing that in a controlled therapeutic way, right? We're not re-traumatizing people, we're helping to expose them to things that they, previously associated with fear so that they can unlearn that kind of connection and heal from PTSD. So, the CBCT for PTSD helps couples do that in a dyadic way. So maybe the couple no longer goes out to movies together because being in a dark, enclosed movie theater is really triggering for a partner with PTSD, or can be, right? So this program would help couples take kind of baby steps toward re-engaging in those important parts of life together, as a way of both improving their quality of life as a couple and also helping to treat the PTSD directly.
And is that something that is done in conjunction with the MDMA therapy if MDMA assisted couples therapy is undertaken, or like in conjunction, meaning not at the same time as the medicine days, but as something that's done in addition?
Yeah, this is actually an area of some debate, I think, right now. So, historically, MDMA assisted therapy has not used any particular psychotherapy orientation. It hasn't necessarily used cognitive behavioral therapies or any other kind of specific therapy. It's been what they describe as like non-directive, right? Or kind of guided by the patient rather than by any sort of provider influence. There's a newer kind of movement within the field to think about how we can pair MDMA assisted therapy with really good evidence-based research supported psychotherapies. So when we think about combining MDMA assisted therapy with something like the CBCT that I just described, people don't necessarily know the best way to do that yet. We're still figuring it out. I think for the most part, we are not messing with the medicine session itself, meaning when folks are under the influence of MDMA for that 8-hour long therapy day, we're not inserting, kind of structured psychotherapy into that time. For the most part, there are actually some studies that are going to start to do that, particularly for exposure therapy for PTSD. And so I think TBD, whether that's more effective. For now, what we do is we sort of intersperse the MDMA sessions at key points along the CBCT treatment trajectory. And then we use kind of the traditional preparation and integration sessions before and after the medicine sessions as well. So it kind of looks like CBCT, prep, medicine session, integration, more CBCT, and then kind of repeat the medicine session.
Ah, okay. Now I'm picturing in my head, we've talked a lot about in the industry, what it looks like inside a one person MDMA assisted psychotherapy session. And there's, in the trials, there's very often like a couple of therapists. There are two. Are there, so for this couples therapy, are there generally two as well? Are there more? Are there fewer?
Yeah, two therapists always. Unless one person is, out of the room using the restroom or something, there's always two therapists in the room, which I think is really important for a number of reasons, including patient safety and accountability of the therapists. So you have the two therapists, and then depending on kind of the model of treatment that you're using, there will either be both members of the couple as well in the room taking the MDMA, or in some cases, just one member of the couple if it's a very kind of diagnosis focused treatment. So for example, sometimes it might only be the person with PTSD who's taking the MDMA, and then we bring the partner into all other aspects of treatment. So two therapists and then either one or two patients, depending.
Okay, that's very interesting. So if there's a couple situation and neither have this formal diagnosis of PTSD, but is that then more likely that they would go into the session together?
So if we're treating the couple where sort of we're just doing regular couple therapy without focusing on the PTSD,
Yes.
yeah. I think still there may be cases where single dosing versus dual dosing, that's typically how we refer to it, one versus the other may be more appropriate. I think for the sort of standard clinical practice when doing couples work is that both people will take the medicine, they will take it concurrently, so at the same time in the same room. With MDMA, you can do a lot of work while folks are on the medicine, which is distinct from other substances like, DMT or ketamine, where you're not doing a lot of work while people are sort of on the medicine. MDMA, you certainly can. And so it's nice to have the couple together so that you can actually facilitate, sort of healing interactions or something like that in the room with the couple. That said, I think there are a lot of instances where both partners either don't want to or can't take the medicine. So, for example, there might be a partner who has a medical contraindication or who is pregnant or just simply doesn't want to take it, right? And so, one of the things that I'm really passionate about is developing models of sort of the surrounding integration and other psychotherapy that can do a really great job at integrating both partners and making the treatment still feel very dyadic, a real couples intervention, even if only one person is taking the medicine.
Very nice, very nice. Yeah, because I was picturing. I'm very, very happy to hear that there are many different options and permutations of what this can look like. I'm just picturing somebody who might be in a couple and they may not feel seen, and I'm just wondering what if they went into the therapy together. And this is because as you had mentioned, most of what has gone on so far was like non-directive therapy, and I was wondering what that looks like as a couples therapist if you have them both in a medicine session and one may be just kind of like dominating the session for whatever reason. And so I was wondering what that looks like, and how you all as couples therapists in those situations manage that.
Yeah. I think a couple of things. So one is that, we're not meeting the couple for the first time in the MDMA therapy room, right? Typically, we're doing a number of sessions of assessment and preparation and maybe even some therapeutic intervention before we get to the MDMA treatment session. So hopefully we've already done some work to set the stage about how we want to balance the interaction between the couple and help them set an intention, right, of what's going to be useful for them. So if we do have the kind of pattern of interaction where one partner tends to dominate or overtalk or overfunction, we might think collaboratively with the couple about how can we counteract that in our medicine session. So I think part of it is in preparation. And then part of it is during the session that this is one place where it's really helpful to have the two different therapists, right? We can kind of team up, right? Have one therapist for one person and another therapist for the other patient and sort of help manage, kind of the pace and flow of the session, right, individually with each partner, and encourage them to go inward when that seems more appropriate, encourage them to spend more time listening to their partner than sharing, if that seems appropriate for the time being. So yeah, we can also do that in real time, kind of in that way.
Very cool. Have you, besides the CBCT, are there other modalities that you've been finding to be useful in these sessions?
So, clinically, I think a lot of different kinds of couple therapies can pair very well with MDMA. The research is not there yet. So, the only research that we have, at least in the sort of modern era of psychedelic assisted therapy research, is with the CBCT for PTSD. And that has a lot to do with the route that MDMA is taking toward legalization, right, for treating PTSD specifically. I think there's no reason though to expect that many different modes of couple therapy wouldn't be very effective with MDMA. Anne Wagner, who's a researcher out of Toronto, Canada, her company is called Remedy. She has written a paper that sort of outlines a general kind of like structure and theoretical set for MDMA-assisted couple therapy that's not specific to any couple therapy modality. So a lot of practitioners are familiar with EFT, emotion-focused couple therapy. MDMA can be very excellent at facilitating the type of enactments that practitioners try to help couples have together in session. I practice a kind of couple therapy called integrative behavioral couple therapy, or IBCT, which really focuses a lot on developing empathy and understanding and acceptance of the ways that our partners are different from us. So again, that probably to anybody who's familiar with psychedelics seems like a very natural fit for psychedelic work, which I agree with. So I think that there are a lot. I have a hard time thinking of a modality that wouldn't necessarily be well suited. I think practitioners can kind of bring their areas of expertise and then think about the specific ways that MDMA might enhance those kind of change mechanisms in whatever treatment they're using.
Gotcha. And by the way, forgive me for the trash truck that is making an appearance in our recording. Hopefully it's not audible. I was wondering if you could share with us, has there been research done on MDMA couples therapy to this point?
No, not outside of the PTSD context. The only research that I'm aware of is there have been a couple of, there's been one published study of the CBCT for PTSD with MDMA, and there are a couple of other ongoing trials that are being researched, again, focused around PTSD. I'm not aware of any research on couple therapy and MDMA outside of that research context.
Got it.
Or the PTSD.
And yeah, and what research do we know that is upcoming or ongoing?
Again, I think it's all focused on PTSD, at least the research that I'm aware of. I am very excited for MDMA to be approved by the FDA for PTSD treatment, and I think then we'll see a rescheduling of the medicine, and we will see a lot more opportunity to do research that looks at kind of the broader relational effects of MDMA. Right now, what we have are what we can infer from kind of clinical studies. I will say that there are some clinical trials that are using very clever research designs that allow us to do kind of crossover designs so that we actually can see what the effects are of MDMA on relationship functioning after the PTSD has already been addressed. So we can kind of, circle our way around getting some research data, but we don't have any clinical trials, at least that I'm aware of, that are addressing this directly. And I'm so excited for the day that we can start getting some funding for those studies.
Yeah, absolutely. I was, since there isn't, I realize most of these are kind of hypothetical questions, but is there ever a format where, because I know a lot of the PTSD trials, MDMA for PTSD, have been 2 to 3 sessions. Does it ever look like maybe each person does the session on their own and then they do a joint session? Whereas, like you said, maybe the initial session has kind of addressed the PTSD in that person more specifically, then that has healed to the point where they feel safe to have a dual session?
Yeah, I think that could be a really valuable model to have. I don't know of anybody who's actually tested that out. That's actually really similar to the model that we use when I also work with ketamine with couples. And so when I do ketamine-assisted therapy with couples, that's often what happens is that the partners will dose separately for their first dosing and then maybe together thereafter. So I think that there are a lot of reasons why that could be really beneficial, including for couples who are maybe a little bit higher conflict and it doesn't actually feel safe to be using MDMA, together initially until we have a little bit more time to work with that.
Yeah, absolutely. I know that your practice, you work with some non-traditional pairings. Can you talk about maybe some of the things that come up in those pairings that might be addressed with MDMA?
Absolutely. Yeah. So my practice really focuses on serving couples or serving people who have expansive relationships. So including folks who are some form of non-monogamous, folks who are in the kink community, folks who are queer, any kind of relationship where traditional couple therapy may frankly not be super culturally competent. So some of the kind of common things that people run into in those styles of relationships are, handling big feelings that come up around, things like jealousy and insecurity and comparison. This happens a lot, in non-monogamy and polyamory. I think that MDMA can be so helpful for helping people change their relationship with those emotional experiences. MDMA tends to increase our window of tolerance for emotional experiences. It makes it safer and easier for us to remain in contact with feelings that might otherwise feel pretty overwhelming. When we're using MDMA in the context of, for example, working with a couple who's experiencing a lot of non-monogamy related jealousy, they may be able to use MDMA to get more comfortable with the feeling of jealousy, get more comfortable leaning to their partner for support with the jealousy, rather than kind of our gut instinct, which might be to avoid the jealousy, make it go away, kind of interact with it in a combative and avoidant kind of way.
That makes sense. And do you envision a time when there will be, I mean, because we've talked about the dyad, but we may have an increased number of people in some of these sessions?
Yeah, absolutely. I don't think there's any reason why we wouldn't be able to use, psychedelic medicines with triads and more. There's actually, some researchers who are doing group models for various different kinds of psychedelic therapies, and these are not groups of intimate partners necessarily, but there's a lot of kind of interpersonal healing. I think that can be really powerful in those contexts. So yeah, I think oftentimes we might have, a whole relational unit of varying different kinds of connections between people that may really benefit a lot from all kind of engaging in this treatment together. There's a really I think interesting balance in MDMA work between the inward focused journey, the kind of individual experience, and then the interpersonal interaction that a patient might have with the therapist or with the other, sort of people who are in the room, their partners or loved ones. And so I think, their MDMA could provide a really good opportunity for healing on all of those kind of dimensions in more than two people relationships.
Got it. Yes. You mentioned briefly about how there are sometimes medical contraindications for somebody to not be able to do MDMA assisted therapy. Are there any relational contraindications? Any relationship issues that you do not think are maybe, before everybody with a relationship problem runs out in let's hope August to get MDMA assisted therapy? Are there any that you said great for addressing infidelity, but any, like, maybe if you could tell us some that it seems to be good for addressing and maybe some not so much?
Yeah. I already mentioned that couple therapy in general is not appropriate when there's intimate partner violence, right? That's not something that we treat dyadically. Couple therapy has the potential to actually be harmful when there's violence and abuse, and, especially forms of abuse that are kind of insidious, like coercive control and things like that in a relationship. We screen really carefully for those kinds of things, so that we are not unwittingly, empowering the abuser to perpetrate more abuse, right? By way of couple therapy. So that's one indication where I would say absolutely not MDMA assisted couple therapy. If you're in a relationship and you feel, that you are experiencing violence or abuse in that relationship, this is not the treatment. We want to instead divert folks to getting, domestic abuse support, safety planning resources, and other ways of sort of keeping themselves safe in or out of the relationship. On the flip side, I think MDMA assisted therapy is excellent for addressing most kinds of like relational, emotional concerns between partners. So healing from infidelity is a great example, communication difficulties, difficulties understanding each other, sort of what feels like irreconcilable differences coming up between us. Anything where the sort of stuckness that couples feel is something around emotional processing that needs working through. I don't know that MDMA assisted therapy would necessarily be as helpful for couples who are experiencing kind of real more logistic concerns. Sometimes couples land in couple therapy because they just like can't figure out how to manage their schedules together, and they have a lot of external stressors and kids and all of that. Although maybe MDMA would help folks feel a lot better about those stressors.
Yeah.
I think, yeah. And, like I said, we don't have the research to know, on an empirical basis, right? What are the most indicated concerns for MDMA with couples? I'd love to continue to gather those data. But I think, more problems than not are probably effectively addressed by MDMA with couples.
Yeah. And is integration generally done together or separate or both?
Together is what I would typically recommend, unless there's some really good reason to not do it together. I think integration is a like really super key opportunity to make sure that the treatment is really dyadic, to help the couple restructure their interactions, to help them get unstuck from sort of patterns and and unhelpful, maladaptive, kind of interactions that they were having before. There's that kind of critical window, right, when we do the integration, where they have this beautiful opportunity to see things differently, feel things differently, and connect differently. So unless there's a really compelling reason not to, I would say for sure that should be done together.
Got it. And I just have to ask this because I think this is like our first couples episode, one, maybe ever, but two, definitely since this happened. But if you recall, there was this kind of an uproar when Jonah Hill had basically like weaponized therapy speak and seemingly like therapy concepts against his partner at some point. And we've done a number of episodes on like psychedelic narcissism and psychedelic self-absorption. I'm imagining that if that all piled on together, that could be a very sticky situation for whoever is on the receiving end of that combination of things. Is there a way that in this you can try to protect against that?
Yeah. I'm glad you brought that up. That I remember when that happened. He, I think like weaponized the concept of boundaries, right? To try to control what his partner was wearing or something like that. And I was like, that's not a boundary. I think I went around just like shouting that for about a week after that. Like, that's not what boundaries are. Yeah, I agree with you. I do think, any tool can be a weapon if it's misused, right? And I think MDMA is a very powerful tool and can therefore be a very dangerous weapon if we're not careful with it. It certainly induces heightened vulnerability. And in couples work, when we are in a safe and trusting environment, vulnerability is so important and so powerful, right? And it's important that we don't put our vulnerability in the hands of people who are going to use it to harm us. I think as practitioners, it's our job to do really thoughtful and careful screening to make sure none of those abuse tactics, even psychological abuse, like more or less calling your partner a slut by leaning on your own sense of quote unquote boundaries. I think it's on us to really carefully screen for that, right? And intervene appropriately, and to not treat all perspectives as equally valid when one person's perspective is being used to disempower somebody else, right? I think there's absolutely a lot of ego and a lot of, kind of a toxic guru model, right? That can show up in psychedelic assisted therapy that as a community, as practitioners, as participants, we just like need to keep an eye out for that, right? And keep ourselves accountable as a community to make sure that we're not giving folks a pass, right? And some kind of spiritual bypassing way.
Yeah, absolutely. That was my picture. I mean, and I think, and I'm going to make this guess, but I think it's probably less common in MDMA because it's it's more like an empathogen than a hallucinogen where you're like meeting God kind of thing. But
Yeah.
I can imagine if, one partner is doing a different psychedelic therapy, they quote unquote meet God and the other one doesn't, that there's kind of like, that guru psychedelic, I now know the wisdom is then weaponized against the other. And like I said, MDMA maybe not so common, but I could see that being a danger perhaps as other psychedelics move into the couples therapy realm.
I totally agree. I think that's a danger even outside of the couples realm, right? Like I don't think the goal of psychedelic medicine is to like give people more of a sense of ego about themselves, right? Like I'm the best at, doing psychedelic therapy. Like that's not our goal at all. I agree with you that I think MDMA probably has less risk of that than other substances because it really does tend to boost our sense of empathy, connection, understanding of others. Right. It is so empathogenic. But yeah, I think that's an important thing to watch out for, right? And if we're clinical providers, we can watch out for that on behalf of our patients. But even as community members, like we should keep an eye on that and make sure that we're holding ourselves accountable.
Yes, I love that. This has been a fantastic discussion. I cannot wait as this field progresses. We'll have to have you back a million times to like keep us updated on the field. But in the meantime, can you please tell everybody where they can find out more about you and your work?
Absolutely. Yeah, I cannot wait to come back and have actual data to answer these questions with. I cannot wait. So you can my private practice, my group practice that I run with my co-founder Chandra Khalifian is called Enamory, spelled ENAMORY. So you can find us at our website, which is enamory.org. We also have an Instagram where we post relationship advice and educational videos. If you're in San Diego, we host a number of community events that are focused around around expansive relationships and education about psychedelics and how that can work to support your expansive relationship. And then we, of course, also have like a private social network community hosted on Mighty Networks for folks who really want to dive in and get some very personalized help with whatever they're looking for. So I think the best place to start is our website, again, enamory.org. And we would just, I'd love to talk with anybody who's got any questions or curiosities about this work.
Amazing. Well, Kayla, truly appreciate the work you're doing and for you coming on and sharing it with us.
Thank you so much. This has been so fun.
Excellent. Well, glad to have you. And for everybody else out there, until next time.
Thanks so much for listening to the Psychedelic Medicine podcast. If you enjoyed what you heard, please leave a rating or review as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.